Welcome to part two of this final lecture. I had just gotten done talking about the plan where the new graduate nurse would go through their home orientation, work for about 3 months on their own, go to a class where each ICU would present very important facts about their unit, and then spend one full 12-hour shift in each of the non-home ICUs, and then they would be eligible to float. So the strengths that I find in this program where it could help increase job satisfaction. So the reason I think it could increase job satisfaction is through building some interpersonal relationships, maybe having a little bit of experience with what they would be required to do in these other units, knowing where things were in these other units as far as the code cart goes, the bathroom, things like that, and kind of knowing what to expect with the patients would all be, it all help to increase job satisfaction. The second strength that I think this program would would help with is decreasing adverse events. So we haven't talked a lot about adverse events, but adverse events happen all the time throughout the hospital. And I couldn't find any really good articles to really state if how many happened the first year or anything like that. But I can say from personal experience with the vast amount of new grads that I have helped orient is a lot of them will have some sort of adverse event, at least a lab error, a patient fall. Um, Usually both of those things within that first year. So having some better understanding of what find your resources, how different units work, who your resources are by building those relationships can help decrease adverse events. And thirdly, to help decrease personal anxiety. So when you kind of know what you're up against, you're still going to have some anxiety. I mean, after being a nurse for almost 20 years, I would still have some anxiety floating to another ICU because I knew I didn't know the patients as well as I would know my own neuro patients. But this would help decrease some of that. Like I said, you've seen it before, you've been there before, you have your notes from class that you can look over, you've made some friends through different things, especially the longer you are at an institution, through your different programs or through your different experiences in your own personal experience with whoever your preceptor was when you floated. So you'll at least have met some people, know what you're up against, and this will all help decrease personal anxiety. So some of the challenges that I see with this thing is increased cost. So to take somebody off of a schedule for a week is an increased cost. Also, by sending them to another 4-hour class is an increased cost. I think that the slight increase in this cost would highly outweigh the cost of training a new nurse or hiring an agency nurse to do this type of a job. Another thing is there's a quick learning time. This program doesn't allow for a lot of learning to be done. So my hope with that is that they would have a strong enough base being within ICU for the past 5 months that they can build upon that base. And that this learning time would at least give them enough to give them some strong resources that they can utilize when they do float. And knowledge retention. Again, with this quick learning time, how much knowledge are you going to retain? And the other question that comes up that I see is if you get all this training and you're 6 months out and you don't have an opportunity to float until you're a year, then it's been another 6 months since you've stepped into that ICU or thought about those different kind of patients and things like that. So I'm not real sure how beneficial that would be if you don't even utilize that information for another 6 months. And again, I did do some research on this and could not find any supporting articles relating to that. So the measurement of my learning objectives is, so again, we're going to go through the learning objectives that I proposed earlier. So by the end of the float ICU orientation, the nurse can assess patients in the MST, CVICU, and CICU. So the way that I would feel that this objective would be met is if the preceptor states this objective has been met by the end of orientation, and this would take on the learning thing of apprenticeship and scaffolding. Again, it's only one day of orientation, but they should be able to do an assessment and know what the difference is in assessment with these patients in one day. The second objective is by the end of the float ICU orientation, the nurse can display professional communication with peers, multidisciplinary team, patient, and the patient's family in the other ICUs. So again, this is going to be based on the preceptor. So the preceptor is going to spend the 12-hour shift with them, and they're going to be able to identify if this has been met or not. And again, this is the same thing with apprenticeship and scaffolding. The third objective is by the end of float ICU orientation, the nurse can explain the top 5 major diagnoses and interventions of the patient population located in each of the other ICUs. So this could be thought about. This could be put on the preceptor, but I was hoping to maybe bring in an educator or a charge nurse or even managers to follow up and ask the nurse about the different diagnoses and interventions. And kind of my idea behind this is if they would do this every so often and they would just bring it up in conversation or something like this might help with the retention of the information. And I would think that this would fall under observational learning. The final objective I would like to talk about is by the end of ICU orientation, the nurse can find the code cart supplies, the med room, the resource items, break room, and bathroom in MST ICU, VICU, and CICU. So this could be done through demonstration or scavenger hunt. So my recommendation would consist of newly graduated RNs would not be allowed to float to other units until they've been hired for 6 months. Newly graduated RNs would attend a floating preparation class. Class topics include common diagnoses, interventions that would be used in all the different ICUs. The class would also have helpful tips from nurses that would commonly float that might be able to help them troubleshoot some of the problems that could arise. And finally, that newly graduated RNs would attend floating preparation class in the fifth month of employment. So this class would that's when you would attend this class. To further recommendations, newly graduated RNs would spend one shift in each of the non-home ICUs units with a preceptor that is native to the training unit. So it'd be somebody that works there all the time, and they could get to know the different staff that were there that day and go through the things that were different in the ICU and with the patients. Um, mentors, charge nurse, the mentors, charge nurse, clinical nurse, resources, or manager or education to check with the RN for the first few times they have to float on another unit. So if they knew that this new nurse was floating to another unit, they would maybe go walk over and check on them and see how they're doing. The other thing that a charge nurse I would recommend for the charge nurse to do is to call the charge nurse in the other ICU and let them know this nurse, it's her first time floating. Can you give me an idea of what patients they're going to get? And the charge nurse could call that nurse and let them know, hey, you're going to be going to this ICU, and these are the kind of patients that you're going to be taking care of. And then finally, to find a way to analyze the 1 and 2 year retention rates prior to the start of this program and after to see if there's any change, to see if that would help with job satisfaction and help retain our employees that we have worked so hard to train. Here are my references for all the articles that I use for this. I really appreciate you looking and listening to my presentation, and thank you very much.